Okay, being 8:30, I'd like to call to order Public Health and Community Services, February 28th. Could I get a roll call, please?
Hendricks. Krieger.
Here.
Van Hoff.
Present.
Sullivan.
Here.
Shorten.
Here.
Altoff.
Here.
Von Bergen.
Here. Thank you for joining us, Member Krieger. Just for the record, could I ask your reason for calling in this morning, please?
Working-related conflict.
Okay, thank you. Then can I get a motion to let Member Krieger, Mr. Shorten and Mr. Sullivan seconds. All those in favor?
Aye.
Those against? Motion carries. Welcome. Okay, so next up, meetings for January 8th. Is there a motion to?
I'll make a motion to approve the minutes as presented.
Okay, second, Ms. Van Hoff seconds. All those in favor?
Aye.
Those against? Motion carries. Okay, public comments. We have Nate Johnson with the VAC. If you'd like to join us up here at the table.
Sure. Want to start the clock? Do I get 3 minutes?
I think for staff.
After.
Oh, okay.
Thank you.
So I know I was a little late to the game and getting this put onto the agenda, so I apologize for that. As I'm the new superintendent of the Veterans Assistance Commission of McHenry County, and Mike Iwaniki, who was here for 27 years, has recently left, and we're now in a situation to where we believe that we can and have the need to grow a little bit. We know that we have about 13,500 veterans in McHenry County, and veteran suicide and mental health rates continue to rise. We just got a new report yesterday that says the state of Illinois is ranked 8th in the country for most veteran suicides per capita on an average of 25.6 per 100,000. That's significantly under the national average, which is at about 35.6. And since 2001, these numbers have continued to stay steady at about 17.5 veteran suicides per day, anywhere between 17.5 and 22. So with all that being said, my thought and idea is the VA continues to throw money at these initiatives to reduce or eliminate veteran suicide in the community with little to no results. So our thought process is that we develop a new position within the Veterans Assistance Commission to get out into the community and to get to the veterans where they're at instead of forcing them to come to us in a government building. So we are pushing to build a new position for an outreach coordinator. This individual would have itinerant office space around the county, whether that means they're at the McHenry community-based outpatient clinic, any of the veteran service office posts, McHenry Community College, at NAMI, all different sites, because we want to make it to where the veteran is. We don't want to force them to have to come into our office. As we know right now, about 45% of the veteran population is age 65 and older, and within the next 15 years, 50% of the veteran population will be eliminated due to age. So we're in a window right now where in the next 15 years, we need to ensure that the people that served our country are getting taken care of in the last days of their lives. So it's very important that we are able to get into, like I said, to those locations I said previously, as well as nursing homes, assisted care facilities, and other avenues to where we can get out to them. Many probably already know we have a great relationship with NAMI of Illinois, NAMI of McHenry County. We recently within our office, we just hired a social worker to take on a new veteran service officer role, as well as Kima Ward has just passed the certification exam to be a certified recovery support specialist, and we have a veteran presence in the living room at NAMI 2 days a week. We're looking to eventually extend that to 5 days a week. But as you can see where we're going with this, much of this is to prevent, reduce, and eliminate veterans with mental health issues as well as veteran suicide, and continue to push the narrative that we are here in McHenry County to be the central point of focus for any kind of veteran issues within this area. Last thing before I'm done, we just recently started a new relationship with the Specialty Courts Program over in McHenry, across the street, to develop a standalone veterans treatment court in McHenry County. Currently, they have a track which is based off of the 3 current treatment courts they have. We're working on developing a standalone court where veterans can find a home in the criminal justice system. As we know, many of these suicides, about 70% of these individuals are not using veterans health care, as well as many times are either unemployed, homeless, or involved in the criminal justice system.
Yeah.
All right, that's all I had.
That was 3 minutes.
3 minutes. Any questions?
I have lots of
Mr.
questions.
Shorten?
Go ahead.
So quick question, this is a big one, so if you want to get back to me or point me towards the right. Is there any studies or any data or anything that provides insight as to why there is a growing problem with suicide amongst veterans?
So many times what happens is, yes, I was just looking at the report this morning. There's the 2023 veteran suicide. The 2025 report is based off of 2023's data, and the trend is education and lack of knowing services are available.
Okay. So,
And I can send you that report.
please, I'd appreciate that.
Can I ask if you do that, why don't you just send it to Alicia or to Mr. Hartman, and they can distribute it to the entire committee, if that's okay?
Cool, thank you.
Absolutely.
Thank you.
I will allow you to read it.
Thank you, Mr. Shorten.
And secondarily, just to, offside of my county board responsibilities, you're welcome to come out and visit Nunda Township, and if you guys want to have remote office hours out there, the veterans community out in Nunda. And I'm sure the other townships would be more than willing to, well, I don't want to speak for them. I have space.
Yes, okay, cool. Thanks, I appreciate that.
I know we're under public comment. Really, the intent was just to let you know that PHCS is the liaison committee to the VAC. This resolution that they put together should have gone to this meeting cycle. We just want to put it under you to let you know it's moving forward. We apologize it didn't make it onto your agenda because you should have been the first stop. I do appreciate Nate coming in with a fresh set of eyes, looking at the VAC, how they're organized, how they work, how they operate. This is one of the changes that he sees a need. He's obviously presenting the case for it. But once again, I do apologize it didn't go before you. This will go to Administrative Services and Finance and Audit because it does affect budget. But we just want you to be aware that it is moving forward.
It's appreciated.
Yeah, I appreciate this, and it sounds like a great program, and I'm somewhat confident that there's general consensus here that it would have moved forward through us, so.
Particularly in light of the fact that it really doesn't affect the budget.
Yeah, yeah.
It does not. You probably actually can save money on the budget.
Yeah, I appreciate the information you
Yes.
provide,
Yep.
really.
Yeah.
Thank you.
Nicely done, yeah.
Van Hoff.
Yes, so I have some questions. How does it not affect the budget? Can we get a little bit into that? Because I know.
It's on the. Ken has it.
I think mostly if you just look at the first page, right, it's like all the debits and credits to the different accounts.
So there's some programming that was initiated in the last budget cycle that's not going to be utilized in this next fiscal year. We'll just say there's a dental insurance program at $35,000 that the Veterans Assistance Commission has no business doing or being in the business of administering dental insurance to veterans. So that's a program that's going to be pushed away. Now, if there is a need for it, or we can figure out a way to facilitate a dental insurance program through the VAC in the future, we can bring it back, but there's no possible way we can do it this year.
Once again, fresh set of eyes.
So I just have one other question. So this would create a new position for like a liaison to get out there and work with veterans and find out what's going on. Is there, have you looked at how we would measure the effectiveness of such a program? We know how many suicides that we are having now, the average. Are we going to be looking to see if that number goes down, or is there, do you have an idea of what you would put in place to check the effectiveness of that?
Yeah, so the idea is, yes, we would have to track, we would track metrics on everything that we would do. So the person's goal that would be in this position would be to drive business back to the office or be able to do business where they're at. So if our numbers are going up in healthcare applications received and disability benefit applications received, education applications, if the homeless veteran population is going down, so right now we're sitting at about 21 to 24 homeless veterans in McHenry County right now. So if we see those numbers start to decline and the number of applications processed through the office, those would be our measurables that we can, our quantifiable measurables that we'll be able to show to the constituents. And the idea is to drive up the numbers of federal benefit applications and reduce the number of obviously suicides, homeless veterans, and veteran unemployment rate, all those different things that many times contribute to the higher numbers of veteran suicides.
You said there's 21 to 24 homeless veterans in McHenry County?
And it's a revolving cycle. So the way that HUD looks at this number is we have a facility called New Horizons where they house about anywhere between 16 to 20 veterans. Those veterans are in transitional living, still considered homeless. So they have a roof over their head, but per the HUD guidelines, they're still considered homeless. So anywhere between 21 and 24.
Okay. Thank you for coming in.
Thanks, I appreciate it. Any other questions? Please feel free to ask. I'll get this suicide report out to everyone. Thanks.
Member comments.
Oh, I just wanted to mention that we had a really good meeting at the McHenry County Historical Society last evening. McHenry County Council of Governments. The food was amazing and the company was great and the program was really good. And I just appreciate how much we do to preserve our history in this county. We do a really good job of that, and I would put us up against, you know, any of our surrounding counties. I think we're amazing. So I just wanted to mention that.
Great, thank you. Anybody else? Okay, seeing none, we will move on to the routine consent agenda. Are there any items we would like to discuss? 6.3.
6.3, please. I have quick comments on 6.1 and 6.2, so I don't want to pull them.
Hold on, Mike.
Let's just pull them.
Oh, yeah.
Okay.
Yeah.
Okay. Then we'll start with 6.1. Is there a motion to?
I'll make a motion to approve the resolution.
Okay.
I'm sorry.
Discussion?
All right, just real quick. So this is standard CDBG award. And it's $8,000 or $9,000 for eating assistance.
Yes.
I'm just wondering.
You can stay there, we'll go
We
around.
were hailed. I thought I saw a signal to come up.
Sorry.
You did. I didn't know we were gonna pull 6.1 and 6.2. Sorry, that's my fault.
Yeah, I was going to pull 6.2. That was.
No, so my
Sorry.
understanding CDBG, it's an award for consumer credit counseling services so that they can help with heating bills for residents. And this is a huge question, so again, if you need to get back with me, that's fine. Is there any consolidated data source that shows between LIHEAP, township assistance, CDBG assistance, where all the different resources are or coming from for residents that need help with either heating or electricity? Again, wearing my other hat, I get calls, and this is the time of the year that the calls start to come in because heating and electricity don't get turned off over the winter season, and now they're coming to us. And we're supposed to route folks to really everywhere else where the township is supposed to be the last place. So I'm wondering if there's like any sort of consolidated point that we can determine where they should be turning to.
That's a good question.
That's a good, yeah, I mean, we go through a lot of different things, we talk about, the VAC, what's their background, what can they be eligible for, and then when they come to us in the same realm, I think it's a network, depending on where they would fall into that eligibility. Is there a centralized, that sounds like a heck of a good project.
Maybe it's more of a suggestion or something I can dig into, but, I have residents that call me, and obviously we qualify an award based on the criteria that we have. We have the People in Need book loaded into an AI chatbot, but I don't remember ever seeing consumer credit counseling services come up when I inquired on heating, assistance with heating and electricity bills. So just, I guess, on a broader perspective, how do you get to helping people understand where to go if they need assistance?
Is that what they do? Credit
Part of.
counseling?
Part of.
Portion.
Okay.
Most of it's financial literacy and helping with those.
So, I mean, for people that are in challenging situations, again, to figure out where to go if they need help is a difficult process.
Sure.
And they've been awarded in the past, like many times.
Yeah.
And I kind of feel like maybe that commission maybe should question them how they get people referred and what is the percentage that goes to that versus just the financial education part of it.
I'll say this, one of the big changes, as we look at the next thing on the agenda, one of the big, if you will, changes that Sarah and I are working towards is how, using this data to help, one, where money goes and where the needs are, and really where that concept came from was from our consolidated plan when HUD said, you guys need to focus a little bit more on infrastructure. Right? It doesn't mean we turn away from service providers, but we want to look at where those dollars are spent and what the trends have been. It's natural. It's a natural next step to increase that network. Then I guess and make sure that the availability is there. So so I think that's a good exercise. We're looking at each other like, yeah, that's a pretty good exercise and something we should have. So or at least be able to support that conversation. Right. So we're not the primary source, but we recognize that there's other ones that aren't the primary either, so we're all kind of involved. Yeah.
Just a general comment or thought that popped into my head when I saw consumer credit counseling services, heating bills, who would have thunk? So what else is out there that are who would have thunk that we should be directing people to or making sure that they're aware of the services they can avail?
Okay.
Okay. Any other questions, discussion? Okay, we'll move to a roll call vote.
Hendricks,
Yes.
Krieger,
Yes.
Van Hoff,
Yes.
Sullivan,
Yes.
Shorten,
Yes.
Altough.
Yes.
Von Bergen.
Yes. Okay, 6-2. The motion?
I'll make
Mr.
a
Shorten,
motion.
Ms. Altough, Mr. Shorten seconds. Who had questions on this?
Yeah.
Shorted.
I have some questions. Did you have some questions on that, 6-2? Yeah, I was looking at the different grades, how they would change, so I just like a little more clarification on that.
Sure, so we brought both positions, senior community development specialist and community development specialist to HR for evaluation, just based on kind of how their roles. Every one of those CD specialists has a little bit of a different role, but they're all responsible for much of the same information and operation. So that grade, when reevaluated, did not change. It maintained at an 8E. When we evaluated the senior role, we actually took one piece out, which was supervisory. So there's no supervisory role within that. All supervision or staff supervision falls on Sarah and then myself. So that actually went from an 11E down to a 10E.
Yeah, that's what I was reading. What I was confused on was that, okay, so the community development specialist, there will still be 4 positions and that will remain 8E. Correct?
Yes.
Okay, and then the one that's being eliminated is the senior community development specialist?
That role, yeah, so we're downsizing by one person, one role. There's 2 vacancies right now.
Okay.
We are excited that we're filling the one that's at the community development specialist role, but we're gonna vacate and we're not going to fill the senior role.
Okay, so you'll have 4 positions at 8E and then 1 at 10E. Is that correct?
We won't have that position, but what we're striving for with this resolution is that we would have a job description that those 4 community development specialists would be able to grow into. So it'll be a couple of years of experience in all of the different roles that we play, senior services grant to CDHG, and then all of the sub-assignments within that is our idea. But once that person has that experience, then we can promote up to a senior community development specialist. So that.
Okay, so that's what you meant, and this is what I needed clarification on.
Yeah.
So you said 10E based on experience, credentials, and ability. So once they are there, then that would go into play.
Yes.
Okay, thank you.
Yes.
I understand now.
So to be fair, I left my backpack at the office, I ran out the door, and so I don't have all my notes with me. But is this a net increase on the budget or decrease? Because it's phrased as elimination, but I recall seeing that there was a net increase.
There's the potential. So it's today.
Yeah.
We'll eliminate a role, so there's a net decrease.
Okay.
On our total operations. In the future, when that day comes that this employee or all 4 of them are eligible for that promotion, then there would be an increase.
Okay.
All in all, it's a net decrease, but that today will be forgotten at the day we do the promotion, because that'll be about $4,000 or $5,000. I forget exactly the number in there. But from an 80 to a 10, yeah. So that day will come, and that'll be an increase. And we'll long forgot that we eliminated a $70,000 role.
Okay. And the funding for these positions comes out of the CDBG?
Yes.
Yeah.
Okay, federal funding, okay. Great, that's all I have.
So just one more question. So do you have some kind of training in mind that you would do to get those 4 positions, ready to make that promotion up? And I just wonder, how long do you think that would take? I mean, ultimately, what are you thinking that would?
Lots of cross-training, so that it's not just, they understand just the senior services grant, they're also familiar with all of the programs. So that would be the goal, is that they could essentially run all of the programs if need be, if there was another vacancy. So that's one of the ways to cross-training.
And then, so how long do you think something like that would take?
I mean, we were saying at least they have to be in the position for at least a year, if not more.
Okay.
But it would be, an interview process, and, it wouldn't just be an automatic, okay, you're here a year and now you're a senior.
So then do you see it as that 8E grade just disappearing after, those 4 positions are fulfilled?
No, I mean, the idea in this is to offer some level of advancement.
I see.
And so that when someone comes in, they can grow and then we can help,
So you
champion
still
them.
might have some 8E grades and some 10E grades?
Yeah, yeah, so the 8E is kind of that entry level into that role. As Sarah mentioned, it could be a year, but if you just came in and started that role, it's not gonna be a year. Because I mean, the grant cycle is about a year and a half, right? So it'll take some years if you don't have experience behind you.
Okay, all right, thank you.
Yeah.
Okay, thank you.
All right.
No other questions, comments, discussion? Could we get a roll call, please?
Thornton,
Yes.
Sullivan,
Yes.
Hendricks,
Yes.
Krieger,
Yes.
Van Hoff,
Yes,
Altough,
Yes.
Von Bergen.
Yes. Okay, 6:03.
Thank you.
Thank you
Thank you,
very
thank you,
much
thank you.
for coming in.
Yes.
Yes. Mr. Shorten motions
I'll second.
for 6:03, Mr. Sullivan seconds. Thank you for joining us, Mr. Clark and Mr. Markison. Who would like to start off?
Oh, okay.
Okay, Mr. Shorten.
So I know we talked about this before in the budget process. I understand it, and I agree. I think it's, I appreciate the work that you do, but on boards and commissions across the county, there is a time involvement. Some boards are a little bit more intense than others, and I recognize that the Board of Health is a little bit more intense than others. The question I had was on the resolution that's put before us. It has top dollar amounts, but what we're going to be applying currently, which is $100 per month per board member, and then $200 for the president. But the resolution leaves an opening for, it was 200, 400.
No,
No.
I'll cover that one. So that is just, the statute allows up to 200 for members and up to 400 for the chair. We are proposing 100
Okay.
for members and 140 for the chair.
Okay.
I wanted to include the statute so you had a framework to understand the, parameters that the state has set.
And, okay, I'm supportive of that. I appreciate that explanation. And again, I'm supportive of the resolution. The challenge that we're gonna have, and I think we're gonna have to deal with, is that other boards are gonna come forward with similar requests.
I can answer, because we actually, at Public Health, we actually looked into that very significantly. And again, this is by state statute. The zoning board also is by state statute.
Okay.
Others specifically state there is no compensation permitted.
Okay.
So you have to go back and look at what the state permits and doesn't permit, but it's pretty clear on most of the boards that are allowed a compensation. We have never done it at Public Health, but we've done it in all the others.
Okay.
So I don't think we're gonna have that issue.
I'll relax my hand
Right.
a little bit.
I mean, is this any different than what was talked about during the budget?
No, the only difference I think is we didn't have a set amount. I think we were looking for, I can't remember. Did we have a set amount?
We had this set
Okay.
amount.
I guess my question is, because I think it says supermajority, but was it not included in the budget?
It was not.
This was not included in the budget.
Okay, but nothing other than that, nothing else has changed?
Correct.
Okay. I mean, I was in favor of it back then, so I don't have any other questions.
I'm just curious, why did you choose 140 and not 150?
Oh,
Because he's 140% better and more organized than me.
I can add a little context to this. So the ZBA chair is 140 per meeting.
Okay,
So that'd be equivalent to ZBA chair.
okay, all right.
I don't know if that was the not logic, but it's a good connection.
That's good logic, and then that way you don't have them like getting, well, why does he get $10 more? Okay, great.
Any other thoughts or discussion? No? Well, I think you
Discussed
guys.
this already.
Yeah.
I was just, like I said, I was just surprised it wasn't included in budget when I saw that there was a supermajority required, but.
Well, thank you for coming in. I think this is probably a long time coming, given, you know, the amount of time and work that you guys dedicate to this. So we definitely appreciate that. So with that, could I get a roll call, please?
Van Hoff,
Yes.
Krieger,
Yes.
Hendricks,
Yes.
Sullivan,
Yes.
Shorten,
Yes.
Altough,
Yes.
Von Bergen.
Yes.
Thank you.
Thank you.
That was easy. Thank you.
And I'll also note, just real quickly, remind everybody, again, by statute, the Public Health Board has major requirements about individuals who serve, and most of them are either certified or licensed professionals, which even is more of a reason to recognize that they're giving of their time, and their time is valuable, and so there should be some kind of monetary compensation.
Makes sense.
Yeah. Yep.
Just giving you all.
Okay. No old business? For presentations, how about any reports? Okay. And no need for executive session. Is there a motion to?
Motion to adjourn.
Adjourn?
I'll second.
Ms. Altough, Mr. Shorten, all those in favor?
Aye.
I love being